There has been several calls to permit vaccination against the disease. I have been advised by my team of experts that this will not be in the best interest of both the country and the producers. Vaccination of birds will create an endemic situation, affect surveillance efforts, and affect our export certification, because all of our trade partners only want products from a country that is free of avian influenza, where vaccination is not permitted. In order to contain the disease, our team called for the ban on the sales of live chickens to manage the further spread. This triggered a nationwide concern since a number of livelihoods have been affected. However, this measure was imposed in the interest of the country and the poultry producers at large, and I can assure you that it was not taken lightly. My team has since met with the poultry producers and have devised a solution that will provide the desired disease management outcomes and improve traceability, while ensuring that micro businesses continue with their operations. The buyers or sellers of more than 5 live chickens for any purpose other than direct slaughter at a registered abattoir will be subjected to the following conditions. The sellers of live chickens, including commercial farmers as well as the traders who buy and sell those chickens, must register with the Poultry Disease Management Agency. The Director of Animal Health of the DAF has authorized the PDMA to register and keep records of all parties selling and buying live chickens. The PDMA is an independent organization, and all information about the trade of live chickens will be kept strictly confidential. Only registered sellers and buyers are allowed to trade, and it is the responsibility of both the seller and the buyer to ensure that their counterpart is registered. Farmers may only sell live chickens certified as healthy by a veterinarian or animal health technician. Traders may only sell healthy chickens and must keep records as prescribed. Sellers and buyers registered with the PDMA would have to sign an undertaking to adhere to required control measures. These conditions apply to sellers of live broiler chickens, live spent layer hens, live spent breeder birds, point of lay pullets, and any chickens that may fall into these categories. The conditions also apply to any buyers and traders who buy more than 5 live chickens that fall into the above categories. All stakeholders are implored to comply with the registration and other requirements that are designed to allow the trade of live chickens to continue without compromising animal health. Depending on the level of compliance that is achieved with these conditions, Director Animal Health will review future requirements for blanket bans. Registration forms of sellers and buyers are available on the DAF site www.daf.gov.za, PDMA www.poultrydisease.co.za. All these websites are available. We request almost cooperation of all affected parties in order to prevent further spread of the current outbreak and enhance the disease management efforts. The department wishes to reiterate that the type of virus we are dealing with does not affect people and has been confirmed by the World Health Organization and the World Organization for Animal Health. The meat that is on the shelves is safe to eat, as it has gone through a process of meat inspection and certified fit for human consumption. A number of trade partners have suspended trade on raw meat, eggs, and live birds from South Africa. This is mainly because the South African veterinarians have to verify that the country is free of avian influenza, and since the 22nd June, they could not provide this certification. However, processed meat is considered safe for trade, and some countries will accept this. South Africa introduced the concept of compartments in line with the World Organization for Animal Health guidelines. Raw meat, eggs, and live birds originating from these compartments have been accepted by most trade partners. Our team is already in negotiations with these trade partners to accept our products from these registered compartments. Chicken owners, farmers, and the public should remain vigilant, and all cases of high mortalities in chicken and other birds should be reported to the nearest state veterinarian. I wish to thank the poultry producers for their cooperation and consistent engagement with the department. I also wish to thank my team for the swift response and their dedication. Thank you very much.